When speaking of cancer survival rates, these basically depend on the type of cancer that has affected an individual. In addition to that, it is also based on the level of cancer growth and metastasis. Experts also suggest that the survival rate of a person who is suffering from cancer is also affected by the treatment modality used. This implies that there is no specific or exact survival rate that you can use as a basis in the future. Usually, in every country, there are different details stated about cancer survival rates. That is why some information you might see in some countries might not be applicable to your own nation. Based from the published journals on health and wellness, patients who are suffering from lung cancer might have a 5-year survival period. This means that when the cancer cells are already detected in the advanced stage of the disease, a person might only approximately 5 years of life have here on Earth. As mentioned a while ago, cancer survival rates are not specific. Once you have consulted your doctor, he might not give you specific statistics. Like for an instance, 53% of people who have been diagnosed with lung cancer in its early stage might be given cancer survival rates of about 5 years. On the other hand, some doctors might present more than 5-year survival rate. This is usually based on the information gathered during the diagnostic procedure. There are 2 survival rates that give more precise information about the matter. One of which is the disease-free survival rate. When speaking of disease-free survival rate, this is the number of individuals suffering from cancer who are capable of achieving remission. This implies that they are no longer manifesting any signs of cancer. Another one is the progression-free survival rate. This is the number of individuals who still suffered from cancer, yet their disease is no longer in progress. Particularly, these are cancer patients who have undergone successful treatment but the cancer cells are still not completely eliminated. Once you think that you already manifest cancer cell symptoms, it is important to seek proper consultation and diagnosis. Early detection of cancer cells will lead to higher cancer survival rates. On the other hand, people who will seek late medical attention where their cancer cells have already progressed should expect that cancer survival rates will be low enough. These are some of the things that you need to know when you are concerned about cancer survival rates. Obviously, there are no exact figures that can be recommended to you. This is because of the fact that the cancer survival rates are affected by different factors mentioned. What is more important is for you to prevent cancer cells from developing. You have to make sure that you will live in a healthy way since your lifestyle is contributing factors to the occurrence of cancer. Keep in mind that the saying prevention is better than cure is highly applicable in oncology. Cervical cancer stages. Once you are concerned with your reproductive health, it is important that you have an idea regarding cervical cancer stages. Keep in mind that cervical cancer is one of the common causes of death among women. In the event that you have knowledge regarding cervical cancer stages, it is easier for you to know when you need to seek for prompt medical assistance. In fact, there are some people in the past, particularly women, who have been spared death because they know the states of cervical cancer and looked for the right medical attention to stop the progress of the condition. Cervical cancer is categorized according to cervical cancer stages. The first stage is characterized by limited tumor growth in the cervix. This means that the tumor is not yet deadly and it can be killed using anti-cancer medications available now in most hospitals. Make sure that when you have a risk developing cervical cancer, you will immediately submit yourself to proper consultation. Once the growth of cancer cells has already extended beyond your cervix, this is now classified as the second stage of cervical cancer. Yet, this is one of the cervical cancer stages that can still be cured when detected properly. Usually, there are unusual bleeding episodes that you will experience once your cervical cancer has already advanced to stage 2. A proper diagnosis will ensure you that your cervical cancer stage 2 will not progress to more complicated stages. In the event that the cancer cells have already extended to your pelvic wall, this is now considered as the third stage of cervical cancer. This means that the cancer cells already metastasized to the nearby parts of your reproductive system. This also implies that the cancer cells might go further and damage the nearby tissues in your body. The probability of recovering from this stage of cancer of the cervix is fairly low or high. This depends on a case-to-case basis. Completing the cervical cancer stages is the fourth stage. This is when the cancer cells have already damaged the other vital organs in the body. This is already a very dreadful condition because the chances of recovering are very low as compared to the first three cervical cancer stages mentioned. Yet, miracles do really happen. This is because other cases of stage 4 cervical cancer have fully recovered from this problem. These are the cervical cancer stages that you have to keep in mind. In order to prevent cervical cancer cell advancement, it is important that you will routinely undergo the diagnostic tests, one of which is the pap smear. This is to ensure that early detection of cancer cells will be done and prompt treatment will be applied. This is to ensure that the cancer cells will not metastasize to your other vital organs. The good thing today is that you can already take advantage of the anti-cervical cancer vaccine. These vaccines are offered by many hospitals. And administration of this vaccine will surely prevent the growth of cancer cells even if a couple of years will pass.